Hello and welcome to our channel. Today we're diving into an essential topic: the most common types of bone fractures, what causes them, and who's most at risk. Whether you're an athlete, a parent, or just someone curious about health, understanding fractures can help you recognize injuries and seek medical attention when it matters most. So let's get started. Before we go ahead, a quick reminder: the information in this video is for educational purposes only and should not be considered medical advice. If you suspect a fracture or any bone injury, consult a qualified healthcare professional for proper diagnosis and treatment. Every injury is different and professional guidance is essential for recovery. Number 1. Transverse fracture. First up, we have the transverse fracture, a clean horizontal break across the bone. This type of fracture usually happens when a strong force is applied directly to the bone, like during a fall or an accident. Runners and athletes can also develop stress fractures over time due to repetitive impact. If you're someone who puts a lot of strain on your bones or has weak bone density, you might be more at risk for this type of injury. Number 2. Oblique fracture. Next, we have the oblique fracture, where the bone breaks at an angle. This typically happens when a force strikes the bone at an angle, twisting it slightly before breaking. Sports injuries and high-impact falls are common causes. If you play contact sports like football or basketball, or if your bones are weakened due to medical conditions, you may be more prone to this type of fracture. Number 3. Spiral fracture. A spiral fracture is exactly what it sounds like. The bone twists and breaks in a spiral shape. This usually happens when a rotating force is applied to a limb, like when someone is skiing and their leg twists while the rest of their body keeps moving. These fractures can be serious because they often require surgery. Young children with softer bones and athletes in high-torque sports are especially at risk. Number 4. Comminuted fracture. Now let's talk about one of the more severe types, a comminuted fracture. This happens when the bone shatters into 3 or more pieces, often due to extreme force from car accidents or severe falls. Because the bone is completely broken into fragments, healing takes longer and often requires surgical intervention. People with osteoporosis, which weakens bones, are at a much higher risk. Number 5. Segmental fracture. A segmental fracture is when a bone breaks in 2 separate places, leaving a free-floating segment in between. This type of fracture is particularly unstable and difficult to heal. It usually occurs from severe trauma like industrial accidents or major falls. Anyone involved in physically demanding jobs or extreme sports should be extra cautious. Number 6. Green stick fracture. Now let's talk about a fracture that's common in kids, the green stick fracture. Instead of breaking completely, the bone bends and cracks, but doesn't snap in two. This happens because children's bones are softer and more flexible than adults. A fall with an outstretched hand is a common cause. While green stick fractures heal faster than complete breaks, they still require medical attention to ensure proper healing. Number 7. Open compound fracture. A compound fracture, also called an open fracture, is one of the most serious types because the broken bone pierces through the skin. This creates a high risk of infection, so immediate medical attention is crucial. High-speed accidents, gunshot wounds, and severe sports injuries are common causes. If you engage in activities with a high risk of impact such as motorcycling or rugby, always take extra precautions. Number 8. Avulsion fracture. An avulsion fracture occurs when a small piece of bone gets pulled off by a tendon or ligament. This typically happens during sudden, forceful movements, like sprinting, jumping, or kicking a ball. Athletes, especially those in sports that require rapid direction changes, are at higher risk. Children and teenagers going through growth spurts are also more susceptible. Number 9. Impacted fracture. An impacted fracture happens when the broken pieces of bone are driven into each other. This often occurs in falls where a person lands hard on their feet, hips, or outstretched hands. Older adults, especially those with weaker bones, are most vulnerable. These fractures can sometimes go unnoticed at first but may cause pain and limited mobility over time. And finally, number 10. Stress fracture. Finally, we have the stress fracture, a tiny hairline crack in the bone caused by repeated stress over time. Unlike other fractures that happen suddenly, stress fractures develop gradually due to overuse. They are especially common among runners, dancers, and military personnel. If you have been experiencing persistent pain in a specific area, it might be a stress fracture developing. The best way to prevent this, give your body enough rest and ensure you're getting the right nutrition. And that's it. The 10 most common types of fractures, along with their causes and risk factors. Knowing these can help you take quick action if you or someone you know experiences an injury. If you ever suspect a fracture, don't wait. Seek medical attention as soon as possible.
If you find this video beneficial, like it, share it, and if you are new to our channel, subscribe it. Hit the bell icon to get notifications for all our upcoming videos. Join us to excel in this orthopedic implant industry and to know more about the job and career growth which is available in this industry. Thank you. See you again next week.